In the office today, we're going to talk about how to treat an injury to the rectus femoris muscle. Now, the rectus femoris is one of the 4 quadricep muscles. However, it's the only quadricep muscle that not only crosses the knee joint, it actually crosses the hip joint. And what we're going to focus in on today is injuries of the rectus femoris, not involving hip pain. Now, obviously, an injury to the rectus femoris or any of the quadricep muscles can result in injuries involving knee symptoms. But we're going to focus on rectus femoris injury as it pertains to when you end up with pain in the front or anterior aspect of the hip. Now, as you know, there's a couple primary hip flexor muscles. There's a psoas and the iliacus, but there's 3 secondary muscles, one of them being the rectus femoris, the other being the sartorius, and then we have the tensive fascia lata. So what we're going to do today is, first off, we're going to differentiate where the anterior hip pain is coming from, so you can figure out whether it's a rectus femoris injury or not, because it could also be obviously an injury to the psoas muscle, which, as we mentioned, is one of the primary hip flexors. Also, sometimes pain in the frontal area in towards the groin can be an adductor injury. So we're going to go over a couple ways to try to differentiate which is the injured muscle, and then I'm going to go over some fascia release techniques and stretching so that we can fix this thing. But before we do anything, let's take a quick look at the anatomy. Okay, first let's take a look at the origin of the rectus femoris. This model is as if I'm standing here, I'm facing you, this is the front of my pelvis here, and there's 2 origins of the rectus femoris. One is at this little part here of the ilium known as the anterior inferior iliac spine, and a little bit lower than that, there's another tendon that's coming off of the superior ridge of the acetabulum. Now, both of those origins come together, form the rectus femoris. They come down, intertwine with the rest of the 3 quadricep muscles. They all converge, and all 4 quadricep muscles actually attach in the front of the tibia here, okay? And as we mentioned, the quadricep muscles are known for extending the knee, but the rectus femoris also flexes the hip. Okay, so when you have a rectus femoris injury and you're having pain in the front of the hip, what's causing that pain? Well, usually it's one or both of those tendons that we just talked about have been injured. Now, what causes those tendons to be injured? Like, why does it happen to a particular athlete running down the field and not to another athlete? So let me try to explain with this little model I made out of some exercise bands. If you think of these exercise bands as the muscle fibers of the rectus femoris, and the plastic wrap I put over them as fascia. Now, this is an oversimplified model just for the sake of this video, but let's just say that these bands in the covering of the muscle with the muscle fibers, normally, just like any other muscle in the body, the rectus femoris, the muscle fibers, very elastic. As we move and do all sorts of athletic movements, these muscles in the fascia are stretching. When muscles are stretching, that's great. That doesn't put stress into the tendon. Tendons do not like to get tugged on, and normally they shouldn't be getting tugged on because the muscles are stretching. However, over time, athletic injuries, stress, micro traumas, we break down some of the fascia and the muscle in there, and your body's always trying to repair the best it can. And what it ends up doing is it ends up creating some fascial adhesions, and muscle fibers start getting bound up, kind of almost like stuck together. They start slowly over time losing their normal elasticity. And as it goes through the time and more micro traumas take place, before you know it, you end up with, or you can end up with a lot of fascial adhesions in muscle tissue. When that happens, that nice normal elasticity of the muscle starts to go away. And if I could give you an analogy, you can picture a normal muscle as being like a rubber band, and muscles with a bunch of fascial adhesions as a leather belt. What does leather do? Leather doesn't stretch, it tugs. So if this is my rectus femoris with all this fascial adhesion that is built up over time through all these little other previous injuries and micro traumas and even stress, and we've built up all this fascial adhesions, this isn't going to stretch like it's supposed to. And if this isn't stretching but it's tugging, where is it going to tug? It's going to tug on those tendons that we looked at. And tendons, as I said, do not like to get tugged on. When you tug on tendons, they can get torn, they can get irritated, they get inflamed, and they start creating pain. And that's why a lot of times where, you could be going through these little minor injuries, you can feel some tightness, and then all of a sudden you go to kick that soccer ball, and all of a sudden, that muscle is no longer stretching like it should. That tendon or both tendons get injured, and you create an injury. So what do we need to do? We have to go to the source. We have to get in there, break up this adhesion that's causing our problem, and allow these tendons to heal by restoring the normal elasticity to the muscle. But before we do that, when we're dealing with this type of an injury involving the rectus femoris, let's go over on how we can differentiate to make sure that it's a rectus femoris injury and not an injury of the adductor muscles or an injury of the psoas muscles. Okay, so let's try to determine which muscles involved, whether it's the rectus femoris or your adductors or your psoas or maybe your tensor fascial lata's tight. So first off, we can rule out the adductors by simply just sitting on the floor or on a table, put your legs out straight, just put your knuckles together, your fists together, put them between the upper thighs, and then squeeze them with your legs. Pull your legs together. Usually pain on this motion, since it's engaging your adductor muscles, is a sign of an adductor strain, or with high adductor strain is sometimes associated with a groin strain. That eliminates that. If this is not uncomfortable to adduct and squeeze against your fists, then chances are it's not an adductor injury. Next up is, okay, how do we determine if the tightness is in the rectus femoris or if the tightness is in the psoas? So simply lie back. I'm going to test my left rectus femoris, my left psoas. I'm going to just, nice and easy, I'm going to pull my right knee up. Now don't over pull it where it affects the position of your pelvis. Just kind of hold it up in this position and kind of try to relax, take a couple deep breaths, and just slowly let that left leg come down. I have a little bit of bend in the leg, and I'm going to let it come down. Now, if in this position, I can drop my upper hamstring where it actually is touching onto the bench here, that's an indication that my psoas is actually not tight. It's actually, it has nice elasticity to it. But from this position, if I try to bend my knee on my left side to 90 degrees, and as I do that, that hamstring starts lifting off of the table and that leg starts coming up, that's an indication that my rectus femoris is tight. So when the leg is out like this and it flops down nice and loose, that means the psoas is usually has its normal elasticity, good flexibility. I start to bend the knee and the leg starts to lift up. That's an indication that we're dealing with a tight rectus femoris. Now, one last thing, I'm going to just turn a little bit. If as you were dropping that leg, it wants to kind of swing out, a lot of times that can be an indication that the tensor fascial lata might be tight. Okay, so that's how we're going to differentiate. You run through those tests. Rectus femoris is tight. Here's what we're going to do to fix it. Okay, so first off, we're going to do some fascial release work. Now, fascial release work, you have to make sure that you're really warmed up before you work this type of techniques. Don't do it first thing out of bed in the morning. That's the worst time to stretch. It's the worst time to do fascial release work. The muscles are cold. You have bad blood flow, first thing in the morning. You have to be warmed up before you're doing fascial release work. All we're going to need for this today is we're going to need some type of a strap or belt, and we have a spiky ball. This is a Tai Chi Max ball from OcraMed Health. This thing is awesome for breaking up fascial adhesions. The texture of these balls are going to get deep into the fascia. It's going to break up some of the deeper adhesions. A smooth foam roller is okay almost as a warm-up, but it's not going to accomplish any type of fascial release in that tissue. You're going to take a smooth foam roller, which is so big in diameter, and you're going to put it up against the muscle, and it's just like stepping on a piece of bubble gum. All you're going to do is just be flattening it out. It's like taking a rolling pin over some dough. It's not going to break up the adhesions. It's not going to be able to get in between the fibers and the different muscle fibers in there. But it's okay to do some smooth, take a foam roller and just kind of warm up the tissue if you want to roll back and forth on the rectus femoris a few times to get the blood flowing. That's absolutely fine. But if we're going to get in there to break up this tissue, we need to get in there with something like this. Okay, so first off, we're going to first do a little bit of static kind of work on the area. So like if you get up to that top of that rectus femoris muscle, you can kind of get right up right below where those tendons might be. So say if the tendons are really sore up here, I would go right, an inch or so right below it, get the ball on that part of the muscle. So you get the ball right in here. And then I'm just going to turn and I'm going to just put some weight right onto that ball, just like that. Now gauge your pressure. Obviously, if you've never done this before, don't try to put all your body weight on it all at once. It can leave you sore the next day doing this type of work. Probably the only thing that might be as fun as the only thing that I can think of that's as fun as doing fascia release work is maybe taking a pair of tweezers and trying to take a splinter out. This is not fun stuff. It's uncomfortable. But you know what? It works awesome. You just have to get used to it and you have to gauge your pressure. So I have the ball in there and I'm going to just I'm going to leave it in that spot where I have kind of a knot for about 60 seconds. And I'm going to just kind of slowly move up and down on the ball. I'm going to move side to side. I'm going to kind of even make some diagonal movements for about 60 seconds because we want to get all different angles attacking that fascial adhesions, because fascial adhesions look like a clump of tangled hair under a microscope. So we need to kind of roll it and dig at it from different directions. That's why we roll at it from all different angles and directions. So after about 60 seconds, I'm going to move that ball from this area and I'm going to come down an inch or two, a little bit lower on that rectus femoris. And I'm going to just go through the whole process again, 60 seconds of just mashing up those adhesions up and down, side to side, diagonal. And given the length of the rectus femoris, since it's going all the way up from the hip, all the way down towards the knee, I'm going to make several passes just like that. If you find a good spot that's really knotted and really you can feel that that's a tight spot, spend a little extra time on it. Next, we're going to come back, and when you get the ball, we're going to come back up again, and we're going to get the ball on the upper part again, and this time I'm just going to hold pressure down on it. I'm not really going to move the body around, I'm just going to hold pressure. And as I hold pressure, I'm going to just bend my knee up as far as I can. So this is going to elongate the tissues of that rectus femoris. I'm elongating the rectus femoris in this position, I'm stretching it, but at the same time I'm trapping the tissue underneath that with that spiky ball, and I'm just going to bring it up, and I'm going to go back and forth, nice and controlled, 5 or 6 times. Now, as you come up, if you want, you can grab it and give it a little extra stretch. You can put that strap on and use the strap to give it a little extra stretch. So do whatever you want. Give it a little extra stretch. Give it a 2 count, 1001, 1002, then let it go back down. Bring it back up. 1001, 1002, and do that 5 or 6 times. Then you're going to move the ball down another inch or two and just repeat the process. Bring it up, give it a stretch, 1001, 1002, and once again 5 or 6 times. So that's the second technique. So first technique is you're mashing up, rolling around. Second technique, start back up at the same spots. Just hold the ball, just have your body weight on the ball, but this time we're adding in flexion of the knee so that we're basically going to get in there. The ball is trapping some of that tissue. You're adding some active motion to it. You're elongating that tissue, and that's going to help pull apart some of that fascial adhesion, some of that junk in there that we want to get out. Now lastly, what we're going to do is we talked, the rectus femoris doesn't just cross the knee joint, it's crossing the hip joint. So I'm going to put this, I have like this type of belt where you can actually, has like little straps in here. I'm going to just kind of put my foot through it. If you just have a regular belt, just kind of wrap it around your foot. But get that, this is in particular good for the upper area of the rectus femoris. So get that ball back on that upper area. So I'm going to turn this way. I'm going to get that ball back on that upper area. And I'm going to bend the knee like this. But this time I'm going to leave the knee bent in this position. And the motion that we're going to do is I'm going to extend at the hip. So I'm going to lift the knee up in this position. So and as I do it, I'm going to add by pulling on the strap. So I'm going to lift up, get that knee and upper thigh off the ground, 1001, 1002, and then let it come back down. Then go again, 1001, 1002. So this is a good way to release more of those upper fibers of the rectus femoris by incorporating some active motion, but using hip extension and having the ball in there on the adhesions, and then just pull. It's an awesome stretch on the muscle anyways, but in particular it's with the ball under there, it's going to get a release on that fascia. And then come down. Let's go about 5 or 6 times, lower it down just a little bit, get the weight back on it. Again, get that knee off the ground and the lower thigh off the ground, 1001, 1002, come back down, come back up again, 1001, 1002, and go 5 or 6 times. Now in this particular technique, where I'm just lifting the leg off, you're only going to do this on the upper part of the rectus femoris. Obviously, it doesn't make much sense to go down too low because that part's coming off the ground. So I use that particular technique just to get the upper fibers of that rectus femoris. So there you have it. That's how you're going to release that rectus femoris and break up that fascial adhesions. You're going to grind on it and mash it up. You're going to hold pressure while we move the knee joint and stretch the fibers that way. And then finally, you're going to get to the upper part of the rectus femoris by using the strap and performing some hip extension with the ball trapping the tissue. Next off, I'm going to show you an awesome stretch for the muscle. Okay, next up, we're going to do some stretching with the rectus femoris. Now, I don't want you moving into this stretch if you have a lot of inflammation in those rectus femoris tendons. I want those tendons to calm down first. So spend a couple weeks just doing the fascia release work, get that elasticity back. That'll start taking some of the pressure and the stress off the tendons, and the tendons should calm down and not be as sore. So I don't want you doing this if you have a lot of soreness in those tendons. It's probably going to aggravate it, so wait till it settles down. However, when you're at the point to do it, this is how the stretch goes. This is an awesome stretch. It's one of my favorites. And you're just going to need some type of table. I'm going to be stretching the right rectus femoris. I'm going to bring my left leg out. I'm going to hook my right ankle on the table. And the way we're going to do the stretch, I'm going to drop down first, almost in a lunge position, keeping my torso nice and straight, and then I'm going to lean my buttocks back to the heel, go back as far as you can, and as I'm going back, I'm going to slowly try to drop down even further. So I'm going back and dropping down. Hopefully you're going to be able to work it so that you can get your buttocks right up against the heel with the torso nice and straight. Once you get into this position, I want you to hold it 30 seconds, breathing in through the nose, out through the mouth, nice and relaxed. And as you do it, just try to start just dropping lower and lower and lower and trying to bring that buttocks back to the foot the best you can. You're going to do 3 times for 30 seconds. And even if the other rectus femoris is doing great, I want you to repeat it on the opposite side. We want to work both sides 3 times for 30 seconds. All right, so there you have it. Give those techniques a try. Don't forget, we've mentioned this before, the following day, you could be sore in the muscles in the rectus femoris after you work on it. You could have some black and minor, like small little black and blues on the area. It could just be discolored. It's okay, that's part of doing fascia release work. Just gauge your pressure, take your time. You're not going to solve all the problems in one session. Fascial adhesions break down. I always compare it to peeling layers off of an onion. You just do it a little at a time, little at a time. It slowly makes the onion get smaller and smaller and smaller, okay? So best of luck. People always like to ask, how often should you do it? You can work it lightly every day. If you go at it aggressively and you are a little sore the next day, then skip a day and do the techniques every other day, okay?